Thank you so much for joining us today. My name is Amirah Sequeira. I am the Legislative Director for National Nurses United, the largest union of registered nurses in the United States. We represent almost 225,000 RNs across the country. And I am joined today by my close colleague and friend, Eagan Kemp from Public Citizen.
Hey.
And we are here today to give you an update on Medicare for All from Capitol Hill. So today, Eagan and I are going to be taking you through sort of our view from here in DC about where we're at with the Medicare for All legislation, what the forecast looks like for Medicare for All over the course of this coming congressional session. And we're also going to dive into some other key healthcare fights that are directly related to our fight for Medicare for All, given the realities of our Congress today. So I'm going to kick us off today by sort of reviewing for everybody here where we are at and what we've achieved in recent years with the Medicare for All bill. So as I think many of you know, so many of you joining us today have been activists in this fight with NNU, with Public Citizen, with Healthcare Now, and all of the organizations that we all work closely with in the fight for Medicare for All. And I think you all probably know that in the past 5 years or so, our movement has achieved a tremendous amount of movement in the fight for Medicare for All. If you would have told me maybe 6 years ago that by 2023, we would have completely changed the conversation around Medicare for All in the Democratic Party, I wouldn't have believed you. But by using the power of people, by activating grassroots across this country, the movement for Medicare for All has changed the potential for achieving guaranteed health care in this country. So over the past few years, we've done a number of things. 4 or 5 years ago, together, we introduced a new Medicare for All bill with Congresswoman Jayapal and with Senator Sanders. That bill, the bill we have now, is the most detailed and progressive healthcare legislation that has ever existed in this country. And so many of us put so much work into getting that bill to that level. We thought through all of the types of care that need to be covered in that bill. We thought through the best, most just ways to achieve healthcare equity through how we pay healthcare providers, how we pay hospitals, how we staff hospitals. We have made so much progress in the world of Medicare for All policy through those bill rewrites over the past few years. And together, we have mobilized across the country, both through electoral political work and through direct lobbying of sitting members of Congress, to greatly increase the number of co-sponsors on both of these bills and to increase the number of people who are in leadership positions in the Democratic Party who support our full Medicare for All bill. This past session, in the House, we ended the session with 122 co-sponsors. And just to say, getting to 122 took a lot of work. Activists mobilized in districts across the country. They made phone calls to their members of Congress. They did meetings with their members of Congress, virtually with the DC office, locally, in person, in district. They mobilized, they texted their friends and people in the community across the district to call into those members of Congress. They sent emails, they sent texts, they did petitions. And because of that, we increased our number of co-sponsors on the bill to 122. In the Senate, we ended with 14 co-sponsors on the Senate bill, which is the same as what we introduced it with last May. So that's where we're at. Going into this next Congress, we're looking at a very different landscape in terms of what is possible. So, over the past 2 congressional sessions, together we have all focused a lot of attention on building the legislative record and support for this bill in the House of Representatives because Democrats have been in control of the House and because we have elected more progressive champions and we have done the work to get members of Democratic leadership to start to support Medicare for All and progressive healthcare policy. So, in the past 2 sessions, we made immense progress. We held the first ever hearings in multiple committees on Medicare for All. In the 116th Congress, so 2 Congresses ago now, we had the first ever hearings on Medicare for All in the Rules Committee, the Budget Committee, the Ways and Means Committee, and the Energy and Commerce Health Subcommittee. This past Congress, we had important hearings in the Education and Labor Committee and in the House Oversight Committee. And in the Senate last session, Senator Bernie Sanders, the sponsor of our Senate bill, held the first ever hearing on Medicare for All in the Senate Budget Committee. But now, Democrats are no longer in control of the House, as you all know. Republicans are in control of the House. That being said, Democrats have a clear majority in the Senate. So our calculation sort of changes in terms of what we can achieve this year. We have not yet reintroduced either of the bills in the House or the Senate, and we are looking forward to bill reintroductions coming up in the next few months. So stay tuned on a decision and on information on when those reintroductions will happen. I am quite certain that there will be events, there will be organizing around those bill introductions, and we are going to need everyone's help to put pressure on their members of Congress to get members of Congress on these bills as original co-sponsors. So I want to give you some numbers so you understand the work we have to do. With the change in the House after the November elections, we lost a lot of our former co-sponsors, largely due to retirement or losing elections. So we had 122 co-sponsors last session in the House. Returning this Congress, we have 99 co-sponsors who have returned. Okay, so that's a big loss. Per our calculations, we think we have about 14 newly elected freshman Democrats who are likely to get on this bill. These are folks that made Medicare commitments to support Medicare for All in their campaigns. Many of them would have been endorsed by organizations that support Medicare for All, and some of whom have made commitments that we think we could get them there. So 99 co-sponsors returning. It should be fairly easy to get them back on board. An additional 14 new freshmen who we've got to do the work to make sure they get on because we think we could get them there. But that still leaves us with a deficit. And so we're going to have to work together to put as much pressure on our members of Congress in the House so that we try to reach that 122 co-sponsor number again. In the Senate, it's a little easier. We had 14 co-sponsors last session. We've lost one of those co-sponsors to retirement, but he's been replaced by Peter Welch in Vermont, who supported Medicare for All when he was in the House. So that should be an easier sell. We should be able to get back to that number more easily. And there's one new senator. The election of Senator Fetterman from Pennsylvania presents the opportunity potentially to add another co-sponsor. But I want to remind all of you, every single year when we reintroduce the bill, just because someone co-sponsored it in the previous session does not mean they're going to easily get back on. We always have to do a lot of work. So really encourage all of you to get ready, because the moment we know that we have a bill introduction date set, there's going to be a lot of phone calls to make, a lot of emails to send, a lot of lobby visits to do in your districts and in your states. So that is the sort of overview of where we are right now on the Medicare for All bills specifically. The one thing I'll leave you with before I turn it over to Eagan is that with Democratic control of the Senate, while we have lost the ability to have hearings that benefit us in the House because Republicans are in control in the House, which means they're in control of those committees, on the Senate side, Our sponsor, our bill sponsor, our wonderful champion, Bernie Sanders, has taken on the chairmanship of the Health, Education, Labor, and Pensions Committee, which is fundamental to Medicare for All. And so we have some real opportunities while Senator Sanders is chairing this committee to think about how we build the legislative record in the Senate and how we potentially see movement on Medicare for All or on pieces of Medicare for All under his committee leadership. So I'm going to pause there and turn it over to Eagan, who is going to talk more about some of the other bills related to Medicare for All this session.
Yeah, thanks so much, Amirah, for highlighting where we are in the fight for Medicare for All and sort of all the success that we've had so far. And special thanks to Healthcare Now for hosting this conference, which is always fantastic. My name is Eagan Kemp, and I'm the Healthcare Policy Advocate for Public Citizen. And as always, it's a pleasure to be with you all, even virtually. I'm heartened by the progress we have made on Medicare for All. We know that there's going to be a lot of opportunity, as Amirah highlighted, for more attention on Medicare for All once we have sort of the House and the Senate bills timelines and then the releases. There's going to be a lot of excitement around that. Yeah, I thought it'd be good to sort of take a step back and highlight some of the additional legislative fights that will have a bearing on health justice and broader justice fights. It's a challenging Congress, as Amira highlighted, for passage of progressive legislation, but it doesn't mean we can't push for our priorities, some of which may be able to pass in this Congress, but also getting our legislative ducks in the row as we work towards the 2024 election. It'll help us be ready for future Congresses, hopefully ones that are much more open to the necessary reforms. And I just wanted to start out by just sort of giving a couple notes on sort of how we're thinking about the problem of healthcare broadly. The healthcare system is really failing the American people. It is defined by wealth-based rationing and barriers to access. High quality care is a privilege reserved for the wealthiest few. Large corporations and corporate greed are largely to blame. The healthcare system's failures trace overwhelmingly to giant insurance companies, hospital chains, and drug corporations that dominate the system. Their relentless greed leads directly to rationing and price gouging. The problems are growing worse. Healthcare access is worsening as healthcare companies consolidate into ever more concentrated corporations and predatory private equity firms gobble up providers in a number of different sectors. The government continues to be ripped off along with patients. Americans are being gouged both as consumers and as taxpayers. All of these problems have simple solutions, including Medicare for All, but it doesn't mean that it's going to be easy to get there. And so I wanted to highlight sort of a few particular areas where there's exciting stuff going on. It may not get past this Congress, but is something that's on the horizon. And so first in the area of Medicare improvements. Medicare improvements, there's some pieces that can be done through the administration, but a lot of that will need sort of legislative support, especially to go broader. One of the first areas is on expanding Medicare to improve better dental, vision, and hearing. And so the Biden administration has already taken some steps on these, using expanding sort of current authority, but to really have sort of the whole scale, broader expansion, we're going to need congressional action. And there's a few bills that touch on sort of different pieces of dental vision and hearing, and that's an important area for focus, and something that we likely will see both in Senate Finance and Senate Help in terms of hearings, and worth engaging and worth sort of your time. Another area that's a little bit newer around Medicare improvements is an out-of-pocket cap. It cap the expenses for seniors and other folks on Medicare. CBO, the Congressional Budget Office, recently estimated that it would actually bring savings because more folks would move from, instead of signing up for Medicare Advantage, would sign up for traditional Medicare. This would mean it would sort of put traditional Medicare on a more level playing ground, with playing field with Medicare Advantage, where a lot of people's caps, out-of-pocket costs are capped. And another important part of that is better Medigap protection. So folks who are signing up for Medicare are able to sign up for a plan that does help cap their out-of-pocket expenses. But if somebody initially signs up for Medicare Advantage and then tries to go back to traditional Medicare, they can run into some big challenges. Another important area within improving Medicare are long-term care and the care economy. It's an area of interest for the Biden administration and potentially a place where there can be some bipartisan solutions there. Um, Moving into sort of the privatization of Medicare and sort of the dangers therein, there's a major role for both Congress and the Biden administration on this as well. Special thanks to all the folks out there that have helped push back on Medicare privatization and ACO REACH, formerly Medicare Direct Contracting Entities, specifically. We've had some big wins in these areas, but we haven't killed off ACO REACH, and Medicare privatization continues to expand. As folks will have seen, Medicare Advantage companies recently successfully pushed back on only a 1% increase in their premiums. There was a bit of a silver lining to that cloud, in that it was one of the first losses for the Medicare Advantage companies, in that it will be phased in over 3 years, not immediately as we had been pushing for. So it's going to be important for us to redouble our efforts. We saw massive lobbying from the insurance companies, Medicare Advantage companies, AHIP, and others. Really pushing to get as many dollars out of the Medicare program as they can. Um, Another important thing, as Mira alluded to, would be hearings in Help and Finance on these issues. Senator Sanders is planning to do a number of different topics within the healthcare sphere, but including insurers, Medicare Advantage, sort of the broader role there. There's also a role for finance, which has a bit of the jurisdiction on Medicare Advantage, and there's some interest from Wyden and his staff on things around provider directories, misleading advertising, and so there's potential legislation in those areas as well. Another important area is insurance denials of care, and I think something a lot of folks are familiar with, and a lot of groups that are in sort of the Medicare for All sphere are working hard on, including People's Action, really highlighting stories and helping people fight back against denials of care. And we're seeing much more of that in Medicare Advantage, which raises a lot of concerns and is an area where we and a number of other folks are pushing the administration to do better, to better protect seniors from these companies that are taking advantage of them through things like narrow networks, through things like pre-authorization of care. And a lot of times it means a person on Medicare Advantage may not be able to get the care that they would have been able to get if they had been under traditional Medicare, and that's just not right. Another important area is on healthcare consolidation, including the role of private equity, which are companies that come in, buy up a whole bunch of providers or hospitals in a particular region, and then really increase prices. One of the ones that was most recently introduced was the Healthcare Ownership Transparency Act from Rep. Jayapal. It would require private equity firms and other investors to better disclose ownership of health facilities, including nursing homes, where we've seen a lot of abuses from private equity. Under the legislation, corporations would have to disclose a number of important things, including assets, debt, financial transactions for the last 10 years. And they would have to do all this in order to be part of the Medicare program, something that most of these folks at least get some of their revenue from. It also requires HHS, the Department of Health and Human Services, to create a task force on private equity and healthcare consolidation, and requires a GAO report, something that I think a lot of folks in this industry just don't want to see, and should help us fire us up to redouble our efforts. A bit of a broader one is the Stop Wall Street Looting Act from Senator Warren and Rep. Pocan, which would increase accountability for private equity companies across industries and reduce their ability to profiteer without consequences. Among other things, it would require private equity firms to share responsibility for the liabilities of companies under their control. This would require private equity owners to shoulder responsibility for debt and pensions. One of the ways that private equity companies make money right now is getting out from under pensions, or saddling companies with debt and then leaving them to go bankrupt. This Stop Wall Street Looting Act would put an end to that. It would also better protect workers and consumers in the event of an acquisition that does declare bankruptcy. So instead of the investors getting their money out first, workers and consumers would be protected first. Also, in this area, we see a lot of private equity diving into healthcare data and not protecting it as well as they should. Obviously, them trying to sell off different parts of your healthcare data threatens a lot of aspects of your life. The Health and Location Data Protection Act from Senator Warren in the Senate and Rep. Scanlon in the House would ban the sale of health and location data. And this is particularly crucial for Americans seeking access to reproductive care in sort of the post-Roe world. And it would better protect patients from a crucial gap in current privacy statutes and prevent unscrupulous companies from profiting and placing personal information at risk. Another important one when it comes to transparency is the Medicare Advantage Consumer Protection and Transparency Act, which has been put forward by Katie Porter. It would significantly increase the information available on Medicare Advantage plans, including information on claims, denials of care, coverage policies, to both federal oversight officials as well as to the public, crucially, so that folks, as they're considering Medicare Advantage, can be making a much more informed choice. Because I think folks may think they're getting something good because they get sort of splashy ads in the mail, but when push comes to shove and all of a sudden they need cancer care, it's a real challenge. And that's what studies and GAO and HHS, Office of Inspector General, and others have found. And so this particular bill would allow additional information, and the relevant agencies would be able to undertake better oversight. And there would also be steps to that would hold bad plans accountable. Another important area is on the issue of prescription drugs. One of the things, sort of starting off, we had a big win, obviously, in the IRA. It's crucial to defend the drug pricing and access reforms that came from the IRA, the Inflation Reduction Act, against attacks, and expand the benefits of negotiations and price spike protections to more people with Medicare, to people with private insurance, and people without insurance. It's also important to put an end to ever increasing drug launch prices. There's legislation out there that would remove the prohibition. We also need to remove the prohibition on negotiating prices for drugs that have been on the market for fewer than 9 or 13 years to ensure patients who need newly launched drugs are not vulnerable to drug corporation price gouges. We also need to curb monopoly abuses of the pharmaceutical industry by prohibiting anti competitive behaviors such as product hopping, filing sham citizen petitions, and entering pay for delay deals, reducing the exclusivity period for biologic drugs, and licensing competition when drug companies abuse their monopoly privileges through excessive pricing. We also need legislation that would provide greater transparency into drug price research and development costs. It would help shine a light on the true costs of pharmaceutical R&D, something that they really pretend is the reason that they price gouge when it's often not at all related. They would be doing it anyway, especially for the drugs where the federal government is footing a lot of the bill for that research and development work. It'll also be important to undertake defensive work, oppose any legislation that would provide prescription drug companies with longer monopoly periods through patent and exclusivity extensions, hence the ability of pharmaceutical firms to file overly broad patents. And another sort of specific piece of legislation that I think most folks may have heard of is the Insulin for All Act, coming from Senator Sanders and Representative Cory Bush, which would cap the price of all insulin at 20, as opposed to just for certain populations. There's also important other defensive work that we need to keep in mind, especially with a Republican House. One of the big areas that we're obviously going to see are Medicaid work requirements. That's something that they've highlighted. There's also ongoing threats to VA, attempts to privatize care or send folks out into the community, but without sort of sufficient accountability. There's just the VA has fantastic doctors and VAMCs that provide care, and the folks in the community aren't necessarily at the same level or able to provide the same care. And so those, in addition to sort of any efforts from Republicans to pass expansions to Medicare Advantage. I mean, I know at the beginning of the session we were hearing rumblings about sort of a Medicare Advantage for all. So trying to take over the fight for Medicare for all, but making it in service of corporations instead of in service of the American people. There's also important work going on in the area of health equity. One of the pieces is the Anti-Racism in Public Health Act from Representative Ayanna Pressley and Senator Elizabeth Warren. It seeks to demonstrate the momentum for the anti-racist public health policy. There are alarming rates, as most of you know, in racial disparities in health outcomes. Can be seen in the prevalence of a multitude of chronic health condition. However, comprehensive research on the public health impacts of structural racism is significantly lacking. And this bill would take a federal stance on the the crisis by declaring racism as a public health crisis and pushing the CDC to develop additional initiatives for the studying of it. In addition, the Black Maternal Health Momnibus Act includes a number of different provisions that would improve access to care and seek to bring down racial health disparities, including addressing Black maternal mortality rates. In addition, there's sort of some broader areas where it makes sense for us to look at how we fight and sort of bring the fight to healthcare beyond just healthcare. So when we're thinking about reducing corporate influence in our elections and in Congress, that's got to remain a major focus. So including things like passing the stuff that was previously included in HR1 and other democracy and voting rights and improvements, things like ending Citizens United, which obviously allows corporations to funnel money into fights against all sorts of progressive priorities, including Medicare for all. Undertaking campaign finance reform to improve accountability of legislators to their constituents instead of to wealthy donors, and passing limitations on the revolving door of corporate lobbying firms hiring folks the moment they leave Congress or the administration to lobby on behalf of the folks they were just negotiating with. I'll now turn it over to Amir to see if there's any sort of additional legislative priorities on her docket, and then we'll take some of your questions.
Thanks so much, Eagan. So the one thing I wanted to add is from a healthcare worker perspective, um, we are seeing the potential coming out of the Senate, but with interest from the House, for bipartisan legislation to address the crisis in the healthcare workforce. And this is of immense interest and concern for healthcare workers and certainly for our union, for nurses across the country. There is both an opportunity here, and we are also likely under threat. And in this process, we may be our healthcare workers, our registered nurses, and our healthcare worker unions may be further under threat by the same corporate interests that fight against our Medicare for All vision. So, as you can imagine, the hospital industry, our nurses' employers, hospital employers, are using this moment where the country is talking about the staffing crisis in the healthcare industry, where the country is talking about specifically the staffing crisis in nursing. And the industry has used this moment in the pandemic to put forward a narrative of there being a shortage of nurses and a shortage of healthcare workers. And that is a false narrative. We don't have a shortage of registered nurses in this country. We actually have a lot of registered nurses who are actively licensed, but who are choosing not to work. And the reason it's important to raise this right now is because the industry, by populating the airwaves in Congress and media across the country with the concept of a nursing shortage, they are laying the groundwork to pressure Congress and governments across the country, state governments, local governments, and also the federal government, to pass legislation and regulation that is anti-labor, that will increase their profits and be terrible for patient care. And this is deeply connected to our fight for Medicare for All, because if the industry is successful in pushing forward policies that will descale our healthcare workforce, basically, what does that mean? It basically means they're trying to pay less money to have lower licensed, lower educated healthcare workers perform the duties of higher licensed and higher educated workers. From their perspective, this is a way to decrease their labor costs and increase their profit margins, right? It's the same reason why they fight against Medicare for All, right? This is all part of their quest to increase their profit margins. And so if they succeed in a number of policy options that would continue to descale our workforce, that would do things like move patients who need acute care in acute care hospitals into the home in order to save the hospital money and increase their profit margins. If they are able to do things like change licensing laws for healthcare workers so that a patient in New York gets telehealth care from a nurse in a state that doesn't have a union, then the hospital is paying less money for that telehealth care than for the patient to receive the care that they should get in person in New York. I'm just giving you an example of a state with high union density. There's a whole bunch of policy options that the hospital industry is throwing out right now. And rightly so, Congress is very concerned about the staffing crisis in our nation's hospitals. The hospital industry is trying to make sure that concern translates into these policies that will be terrible for patient care and for healthcare workers. And so we have an opportunity here to fight to increase staffing for registered nurses and other healthcare workers. We have an opportunity to fight to ensure that whatever bipartisan bill the Senate or the House comes out with addresses the real problems we are facing in acute care hospitals, the healthcare workers are facing in acute care hospitals, which are dangerous working conditions, unsafe staffing levels, high rates of workplace violence, and a continued lack of infectious disease protocols and PPE in the midst of an ongoing pandemic. And so we have an opportunity to try to make sure that Congress addresses dangerous working conditions. By doing so, we would increase nurse and worker retention, bring nurses back to the bedside. But that is not what the hospital industry wants to do. The industry does not want to be forced to pay any more money on labor. They do not want to spend any money on protecting our nurses and protecting our healthcare workers. And so this is important because when we win Medicare for all, we need a strong nursing workforce. We need a strong healthcare workforce. We need healthcare facilities and acute care hospitals that are providing quality therapeutic patient care. And a lot of these mechanisms that are fundamental to retaining a strong healthcare workforce are built into our Medicare for All bill. Mandatory minimum safe nurse to patient staffing ratios, workplace violence prevention, ensuring strong pandemic protections, and that hospitals have strong medical supply chains so that in the event of any infectious disease outbreak, workers are protected. These are all things built into our Medicare for All bill, and they are things that the hospital industry is currently fighting against. And so I want to raise that for you because there's a lot of talk in Congress right now about some sort of potential bipartisan bill to address the healthcare workforce. Unfortunately, many people in Congress, including some of our most progressive friends, are buying into the narrative of a nursing shortage. And we are very, very concerned about that. And there is a direct link between our anything past this session to do with the healthcare workforce and our fight for Medicare for all. So I think that's the last thing I wanted to raise. I might actually just point out, Eagan was talking at the beginning of his remarks about Medicare expansion and dental vision hearing. And Eagan, you might have said this, but I just want to highlight it, that over the past few years, we got President Joe Biden to support us on expanding Medicare to include dental, vision, and hearing, and on lowering the Medicare age, and on strong drug price negotiations under the Medicare program. That was an immense victory. And while we weren't able to pass most of that, dental, vision, hearing, and lowering the age, in the Build Back Better fight, which culminated in the Inflation Reduction Act, we did make progress on drug price negotiation in that bill. And it is the first time that the progressive movement, that our movement, has won against big pharma. And so I think that is an immense victory that we need to remember as we keep going in this fight for Medicare for all, in this fight against big pharma, against the big insurance companies, against the terrible hospital corporations. I know that it can feel, and certainly I feel it sometimes, it can feel daunting to keep going in our advocacy on Medicare for all when we've got Republicans controlling the House, when we've got Democratic senators who are quite conservative who block us in the Senate, even on incremental priorities like dental and vision and hearing and Medicare. But what I think that victory with Joe Biden supporting those priorities shows is that sustained advocacy, even with people that we think will not come over to our side. Sustained advocacy and the power of people can change what a politician supports. So we will pause there, and I think we're going to take some questions, Egan. Um, I'm just taking a look.
Yeah, I think the first question that I've got was from Dr. Jacob Rabbit or Mr. Jacob Rabbit. What about Ro Khanna's bill on waivers? And so, for folks not familiar, Ro Khanna over the last few Congresses has introduced. This was also something that Jayapal had carried in previous sessions, a state-based universal health care act. It's in the process of being reintroduced. It sounds like some improvements have been made as they've been made sort of each session, but at its core it would create a waiver that would allow states to develop their own plans to provide access to healthcare for all of their residents, including access to federal funding streams and regulations flexible enough to support affordable, universal healthcare plans. In just a little bit of sort of details, folks understand, in order to apply for the waiver, participating states or groups of states, so it could be sort of a consolidation of multiple states, must provide plans that would provide healthcare to at least 95% of their residents within 5 years. So not just sort of what the broad structure would look like, but what are the processes to make sure that they are achieving universal coverage. And if they don't achieve that 95% in the first 5 years, what their plan would be to sort of redouble their efforts and sort of get to that 95%, at least 95%. It would also ensure sort of better federal technical assistance would be made available to states in developing and implementing these plans.
I'm seeing in the chat just some folks pointing out that they're in states with senators who may be Democrats, but who are really against Medicare for all. And so I just want to say, I know that can be so frustrating, but I just want to encourage us, even when we are live in places with members of Congress that are seemingly very against Medicare for all, the only way that we change their minds is by talking to them, is by pressuring them, because at the end of the day, our politicians, they work for us. They work for the people that elect them. And so the more people that we can mobilize to talk with them, to advocate for Medicare for all to them, the more chance we have of changing their minds. And sometimes people do change their minds, whether they change their minds because they agree with it, whether they change their minds because they feel like the power of the people supporting an idea is greater than, say, the power of the hospital industry or the pharmaceutical industry, right? Whichever reason, there's a chance to change their minds. So would just encourage you to keep going, even if you live in a place with members that seem really against it.
Next question I see is from Stephen Spitz. When are the Medicare for All bills going to be introduced in the House and in the Senate? Within the next couple months is, I think, as best as we can. Hopefully within the next month, but details will be coming around soon as we've got them, and as soon as sort of the Sanders and Jayapal offices are sort of ready to announce their plans. But I think that within the next couple months is the safest I feel saying. I don't know about you, Amirah.
I'm just looking, I'm seeing a question from Jillian about some of the talking points and our strategies that have been the most effective in our experience, Egan, to sway reluctant legislators toward Medicare for all. So I'll give you some of the things I have found most useful, and Egan, you should weigh in. One thing I found really useful is explaining to people and showing legislators the numbers, showing legislators numbers that show how other countries spend less money on healthcare, but have better outcomes, have higher life expectancy rates, have better infant mortality and maternal mortality rates, things like this. Showing them those numbers that show that we spend by far the highest amount of money on healthcare, and yet we have the worst patient outcomes of any OECD rich country. It's wild. And I think that really impacts people because I think a lot of people, even legislators who you think should understand this, there is this narrative in this country. There has been a narrative for a long time that we spend all this money on healthcare and America's got the best healthcare. And I think when people see the numbers and they see the statistics, they see how much better the outcomes are in healthcare systems in Canada, in other countries that have single payer universal healthcare models, it can really impact them. The other thing I found very useful in recent years is talking about the COVID pandemic, because everybody, regardless of your political leanings in this country, saw that our healthcare system was completely unable to address a massive pandemic when it happened. And so I think talking about COVID and talking about how, with a single payer system that ensures that everyone has guaranteed healthcare, no matter where they live, no matter what they can afford, we will, through a single payer system, we will have a healthcare system that can better react to any sort of infectious disease pandemic situation. I found that to be quite helpful. Egan, do you have any others you want to add?
Yeah, so yeah, what comes to mind for that for me is yeah, especially sort of the term reluctant legislators. I really think that it's sort of humanizing the issue for them. I think that's one of the things that some of these folks get really sort of stuck in their head or hear talking points from industry. But if you're sort of having legislative meetings with them or talking with them at events that they hold, and have there's patients there, there's nurses there, there's doctors there, there's union members, there's all sorts of folks that are really currently being affected by the problems in our healthcare system. All of a sudden I think it's much tougher for them to just say no or sort of have a knee-jerk reaction to Medicare for all, because if each of you is there or sort of asking difficult questions like, I've tried to get care this way, blah blah blah, and then you say, and that's why I need Medicare for all. Why can't you support it, or why can't you see the challenges that folks like me experience? All of a sudden, you're having a much different conversation with those folks, and there's a lot of different groups undertaking that activism. I'd say another way, and this may be particularly helpful for folks that are just tired of working on the same legislator, is there's also sort of local things that you can do, whether it's local resolutions on Medicare for all, or pulling together a group of people to have a different type of meeting than maybe the conversations that you've been having, because having undertaking those efforts can change your advocacy or change how the office sees you, or maybe you bring together enough folks that you start pushing, bringing together healthcare power in the district, and all of a sudden that member of Congress is seeing the power that you're generating, and they're much more nervous about being against Medicare for all, because they know when the next primary comes around, this is going to be an issue that they get bird dogged on. This is going to be an issue that they're going to hear from a lot of folks on. I see a question from Henry Moss, that says there are bills to add dental, hearing, and vision to Medicare. Are there bills for capping out-of-pocket costs? So right now there's at least one bill in the works that I know of, Henry, that's not public yet, but is in the process of being drafted and probably should be out within the next month or two. And so you guys will see that soon. I haven't even seen the bill text yet, but I know that some great offices are working on it.
I saw a comment related to our previous discussion about reluctant legislators. Wes Brain says, freedom of choice is my favorite phrase for my conservative hesitant friends. This is something that I think can be so useful. Is there is this narrative that's false that we have freedom of choice in this country. But actually, what they're talking about is like choice of, if you can afford it, of insurance providers, not of healthcare providers, not of doctors, not of hospitals. And I think explaining to both your friends, community members, and also to legislators that in a single payer system, that is how you actually have freedom of choice, right? We will be able to go see any doctor, any healthcare provider, any hospital without worrying whether or not they are in network, without worrying about whether or not we will get a surprise bill that could bankrupt us in the mail. Single payer is actually what will give us freedom of choice. We do not have freedom of choice right now, and I think that's another talking point that can be very useful for reluctant legislators or friends or community members.
Yeah, and it's one of those things that I didn't realize until I went to grad school in Canada, how easy Canadians have it in terms of, I know that not any healthcare system is perfect, but as an American grad student in Canada, and having it be, it was almost too easy to get healthcare because I was confused about how easy it was. Like I thought every step had to be a fight, like it is when I would try to get healthcare in the U.S. And so, I we went to the doctor by just calling, and there was no sort of like checks of insurance. They're just like, oh, you're covered as because you're a grad student, even though you're an American in Canada, and it doesn't have to be as hard as we make it in the US. And I think that's one of the things that's really hard to get sort of out of our, and to get members of Congress to sort of think differently about. But it's an important thing. And as Amirah said, helping folks understand that it's not this difficult in so many other comparably wealthy countries. One of the other comments I saw was from Doug Grinsberg's, that as far as I know, a status quo Joe would veto Medicare for all. And I think that's an important thing to highlight that, as we saw in the last Democratic primary, there was tons of fights about sort of different positions on sort of who was trying to take sort of more, interim milk toast steps. But the movement that we're building for Medicare for all is going to be enough to push these reluctant members of Congress, to push even a reluctant president. We're taking on some of the most moneyed interests in the country, but we're also building the movement that's going to be able to overturn that. And so when the time is ready for us to pass Medicare for all, not even sort of a reluctant president is going to be able to stand in our way.
Yeah, I totally agree with that, Egan. And the amount we pressed Joe Biden for his for all of his opposition to Medicare for all when he was running in the primaries. And I'm going to assume most of us here were fighting hard for the candidate that leads our Medicare for all bill and is our strong champion on Medicare for all. Um, he then came around to the importance of expanding Medicare to dental, vision, and hearing, right? And that wouldn't have happened if it wasn't for a really strong Medicare for all movement. It's just a really important thing to keep in mind. Um, Taking a look here, Egan, do you see any other
I
questions we
see
have?
one from, I'm assuming, Hank Abrons. It's H. Abrons. Given the composition of Congress and with many well-intentioned incremental proposals, how can we do better to get voters and elected officials to focus on single payer as the centerpiece of reform? I think that's a really great question, and it gets to sort of how I've been thinking about, some of the challenges that you have when you have a mixed control Congress. And I think one of the things that a lot of folks understand, even if they're not there on Medicare for all, is they see how Medicare for all has changed the debate on healthcare. And it wasn't longer than sort of 10 or 15 years ago that the fight was, oh, are we going to raise the Medicare age to 67? Whereas now you even have folks like Joe Biden talking about lowering the Medicare age. And so, some of those folks aren't there on Medicare for all, and some will never get there on Medicare for all, but they do understand that Medicare for all has sort of drawn the discussion to the left and really forced people to engage with healthcare uh, writ large, as opposed to just sort of tinkering around the edges, which is what a lot of them want to do. And I think one of the things to think about is sort of the relationships that you have with legislators, sort of not just at the federal level, but who are your state reps, who are your local reps, because a lot of those folks are going to think about moving into higher office eventually. And so if you're building good relationships, if sort of a municipal county member, or a city council member. We've had some that were champions at local resolutions on Medicare for all, and now all of a sudden they're in Congress, and they're steeped on the issues of Medicare for all, and they're ready to fight. And at those lower levels, you can have more direct engagement with them. And so it's not just about sort of, engaging other activists, not just about engaging other votes, but engaging your elected officials, especially at times when they may be more likely to listen to you because they're just starting out.
Wonderful. Just taking a look here for other questions.
Yeah, I think there's an important question from Deirdre Kieli. Why is incremental the chosen way to fight for Medicare for all? At this place, we won't have Medicare for all until 2070. That's an important thing. We can't just rely on incremental reforms. We really do have to be pushing, and why we have opportunities like the Medicare for all rollouts in both the House and the Senate to be pushing hard, and when sort of there's opportunities, to pass local resolutions to really get involved, because we have to sort of build the biggest movement possible that will get Medicare for all over the finish line. So we definitely don't want it to just be sort of incrementalism, or just sort of taking baby steps. We need to also be pushing for Medicare for all and having the folks in committee chairs, like having Senator Sander in charge of help, having Rep Jayapal pushing hard in the House on committees. These are important steps that help us build both the legislative record and sort of the collective grassroots power that we're going to need to pass Medicare for all.
Yeah, I completely agree with you, Egan, on that. Completely agree with you, and it's why it's so important that we have a big bill in reintroduction. It's why it's so important that we keep up the pressure in our communities across this country to keep building support on the full bill, on the full Medicare for all bill. At the same time, Medicare for all is a massive transformational change to the largest industry in this country. And there is a lot of work. If we pass Medicare for all tomorrow, there would be so much that would have to happen because the Medicare, we're not just expanding Medicare to cover everybody, right? That itself is a huge thing. But we are improving Medicare because the Medicare program as it exists right now is not good enough, right? A program that has Medicare Advantage is not good enough. A program that does not currently cover dental, vision, and hearing, not good enough. A program that currently has really high cost prescription drugs, not good enough. There's a lot of pieces here. And so the exciting thing is while we fight for the full vision, if we have the potential to win something that will mean that more people get healthcare or that seniors get healthcare, get dental, vision, and hearing, which is fundamental to their healthcare, that is a step forward, which is exciting. And yes, I'm seeing a comment from someone saying that Canada won it not state by state, province by province. I can say as a Canadian, yes, Canada first won Medicare, their Medicare program, their single payer program in Saskatchewan. And it was a big victory. I would note that the Saskatchewan victory was not the entire program yet. I can't remember exactly off the top of my head. I'd have to look it up. But they didn't win a full single payer system. I think they won it just for hospital care, if I'm remembering correctly, originally, and then they expanded it, and then it spread to other Canadian provinces. But that is a really good point.
Yeah, I think that's all that I'm seeing for questions. Just a quick note on sort of, we're so excited to be at this conference. We're so excited for the weekend. I'm sure we'll see a lot of you folks on different panels. One of the next ones coming up today is on private equity in healthcare, a real sort of pernicious and dangerous part of our healthcare system, where they're buying up and doing all sorts of bad things. So definitely be sure to check that out. Any last words, Amirah?
Just a huge thank you, guys. It's great to be with you today. A big thanks to Healthcare Now, to Ben Day, and to Jillian. We're so thrilled to be with you guys again this year, and wishing you all a really great conference. And looking forward to working with all of you to whip our bills when we reintroduce them soon in the coming months.
Thanks so much, everybody.